Hi everyone, I hope you're enjoying your treatment plans. I'm just going to discuss how to work them, how to find the points and what you need to do just so that they are more effective. So firstly, you need to really do them in front of a mirror because the points are lined up with your eyes, your pupils, your eyebrows, your nose and your lips. So you need to use your facial features to actually find the points so that they can be worked accurately. And you need to work them accurately if you want to get the best results. So what you need to do first is do it in front of a mirror and then rub up and down in front of your ears. I usually use my index fingers, up and down together at the same time, about 12 to 15 times. After you complete the points, you do the same thing again, rub up and down 12 to 15 times. And this is like an opening and a closing sequence. Also, there's a small spine reflected on the face in front of the ears. And by rubbing up and down on this, you're stimulating the spine. And what that does is sort of actually calms you down. So it brings you down sort of from up here, right down here. So you feel calmer when you're actually working the points. So most of the points are either on the forehead or around the nose. They can be on the cheeks, the side of the face, or even here on the chin or around above the lips. So each one is written clearly on the maps of the face. So when I talk about the center of the forehead, I mean in the center here, so it can be a point can be there, or it can be halfway. In the center of the forehead, it can be in line with the outer edge of your eye, it can be the outer edge of your pupil, or it can be the inner edge of your pupil. Some points are found at the end of your eyebrows, and at the end of your eyebrows is often a little dip on the side of your face. Some points are found there. When I talk about the hollow of your nose, or up here, it's just like a hollow in there just above your nostrils. Some points are in there. There's also one point that is found actually on your nose, and to find that, that's with the backache, you go down, slide down your nose, and it's like there's a small dip. It's level with where the nostrils flare out. So that's one point there. Some may be right up in the hairline, which is just up in here. And then if you go at the hairline, you then line it up with either the center of your pupil or the inner edge of your pupil, whatever it says in the description. Now, some other points are right at the edge of your eyebrows. And for that, if it says the inner corner, it means just in there, in the inner corner of your eyebrow, and the same on the other side, just above the inner corner of your eyebrow. For example, neck pain. There's also a point for neck pain that's in the lower third of your forehead, and what that means, if you can imagine this, you divide your forehead into thirds. You've got the top third, so the middle, and then the bottom third. It's sort of like in there, just about there. There's also points for neck pain that are actually on your nose, so they're above the hollow and they're just on the side of your nose. So they're actually on the side of your nose as opposed to in there, and it says that in the plan. One's for shoulder pain. There's some along the eyebrows, and they're quite clearly written, whether they're at the inner corner of the eyebrow, just next to that, or there's some right on the eyebrow in line with your eyes. So that's also written there. With knee pain, just in particular, there are some points that are below the nose, and anything below the nose, even if it's around your lips or on the chin, you don't work if you're pregnant. If you are pregnant, before doing any points, you should really consult with a professional reflexologist anyway. But it's all clearly written in the plan. If you are not pregnant and you're working the knee points, there's one that's halfway between the nose and lips, in line with the center of your pupil, and the same on the other side. And there's some just in the corner of your lips there, and then right next to that too. Wrist and hand pain, those points are all along the eyebrows and the side of your face. One point, it actually says you go across from the orbit of your eye, halfway between your ear and your eye. So that means you'd come here and it'd be there in the middle. The rest are very self-explanatory. Hip pain one is a little bit hard to find because the point is actually, there's a red point right on the curve of your nostril, and there's a blue point also on the curve, but just above that, so higher on the curve up here, and the same on the other side. Period pain is just another one to mention, in that if you suspect you may be pregnant and you've had a bit of bleeding, you're not sure, don't work these points, okay? Because they, again, on here, and below here. If you're obviously not pregnant and have your periods, period pain ones are found halfway between the nose and the lips, and there's either side of this little ridge we have here. There's one there, there's a point next to it, and there's a point directly below there as well. And the ones on your chin are like either side of this bumpy part of your chin, either side there. And it usually says they're in line with either your eye or your pupil. It's all written in the charts. There's ones for toothache that are where the ear touches the face, and that's just right there. Where your ear actually touches the face there, where it's attached to the face, there's a point there. And the same on the other side. And others fairly self-explanatory. So when you've done your points, then you rub up and down again to close the sequence. Only choose one set of points at a time. For example, if you've got a headache and you've got period pain, choose whichever one is the most prominent, in that to get your periods more regular and to help with pain, you need to do the points regularly for a few weeks. Now, you can do them up to 3 times a day, but even if you do them at least once a day and do them every day, it can sometimes not take a few weeks for your whole body to adjust, so your hormonal system to balance. If it is just a headache that you've got, well then do the points for the headache. Backache, something that's more longer standing, can take longer to work as well, but you need to do them regularly. So good luck, and if any questions, you can always shoot me a text or email and let me know, or on Facebook PM me. But good luck, and hope it goes well, and enjoy them, and they really benefit you. Thank you.